I suffer from severe excruciating pain for over 2 weeks, to the point that every morning when I try to get up, without the support of my hands, I can't get up. Then walking was a problem. For a while, I was beginning to get bothered because it looked like when I wake up in the morning, I can't walk. And I was wondering what's the cause of it. Then I tried to carry out some protocols to reverse the problem. I took painkillers, I took herbal supplements, herbal mixtures that will handle pain. I took calcium to strengthen my bone in case it was calcium loss that was causing it. Yet, all I could get was just minor relief. The next morning, I will experience the pain again. Then, as I got bothered about this, I was looking for a solution. Then it now dawned on me. I supplied PEMF mats. Hi, I'm Dr. Onyedika of Cubic Healthcare Academy. Today, I want to talk about pain management. Precisely the right protocols that you can apply to manage pain in the body or reverse pain in the body. As a matter of fact, pain management has been a global problem. All over the world, people are experiencing one form of chronic pain or the other. A number of people have carried out research and have come up with data of chronic pain experience all over the world. In America, it is said that 1 out of every 4 American adults are experiencing one form of pain or the other. In the UK, 43% of adults are experiencing one form of pain or the other. Then in West Africa, it is reported that 21% of West African adults have reported one form of chronic pain experience or the other. That's why I want us to talk about it. But before we get into it, I want to tell you my own personal experience that just happened just less than 3 weeks ago. I had my own fair share of pain problems, and that's what inspired my doing this video. So it happened that I was exposed to some kind of strenuous exercise that compromised my waist, precisely my what we call the tailbone. That's the coccyx, the 4th and the 5th lumbar, or the waist region, the waistline region, and I suffer from severe excruciating pain for over 2 weeks, to the point that every morning when I try to get up, without the support of my hands, I can't get up. Then walking was a problem. For a while, I was beginning to get bothered because it looked like when I wake up in the morning, I can't walk. And I was wondering what's the cause of it. Then I tried to carry out some protocols to reverse the problem. I took painkillers, I took herbal supplements, herbal mixtures that will handle pain. I took calcium to strengthen my bone in case it was calcium loss that was causing it. Yet, all I could get was just minor relief. The next morning, I will experience the pain again. Then, as I got bothered about this, I was looking for a solution. Then it now dawned on me. I supplied PEMF mats, pulse electromagnetic field mat. How about I try it? Now I became curious and I decided to stop all medications, all therapies, right? I had tried painkillers, I had tried massage, I had tried herbal medicine, and all I was getting was just minor relief. So I decided to stop all that and try PEMF therapy alone. 15 minutes of one day, by the next morning, I woke up and I discovered that I could stand up. The pain was not totally gone, but there was a remarkable difference. I was like, wow. I did 2 more sessions, that's for 2 more days, and till today, the pain was totally gone. I was amazed. Coincidentally, shortly after then, I had a number of patients who were coming to me reporting pain problem. I had to use acupuncture and then PEMF therapy as an approach. So that's why we're talking about pain management today. What is pain? I'm going to give you a layman's definition of pain. Pain is the body's way of telling you that something is wrong somewhere in the body. Basically, it is trying to indicate to you that there's a potential tissue damage or there's an actual tissue damage somewhere in the body. Basically, let me establish this fact. Pain is picked up by special nerve receptors called nociceptors. These nociceptors will pick up this signal, and through the spinal cord, they will send message to the brain for the brain to interpret what is going on in the body. The nervous system is the major system that communicates pain in the body. And the three major nervous systems we have comprises of the central nervous system, the peripheral nervous system, and the autonomous nervous system. Now, the central nervous system is basically speaking of the spinal cord and the brain. Now, the nociceptors passes information via the spinal cord to the brain that something is wrong in the body. So, nociceptors are pain communication messengers. Now, let's talk about the various factors that could cause pain. I have listed about 8 of them. Number 1, injury or physical damage. Injury or physical damage. This could be caused by cuts, burns, fractures, muscle strains, ligament sprain, or even post-surgical pain. That is straightforward. Number 2, inflammation. Inflammation could happen on account of arthritis. It could happen on account of infection, or even a tissue of the body that is swelling. Number 3, nerve-related pain. I'm talking about neuropathic pains, okay? Examples of such, you have like sciatica, diabetic nerve damage, or pinched nerves. Number 4, musculoskeletal pain. Musculoskeletal pain. This can be caused on account of maybe poor posture, back pain, neck pain, and so on. Those are another angle through which you would experience pain. Number 5, internal organ pain, or what we call the visceral organ pain. These are, speaking of pains that arises on account of disorders going on in the organs of the body. Examples of such include stomach ulcer, kidney stone, maybe gallbladder or liver problems that is bringing maybe pain in the upper quadrant of the stomach and or left lower quadrant and so on. Those are examples of internal organ pain. So you can see that there are various areas through which pain could happen in the body. Number 6, chronic disease. Chronic disease could be another factor or another cause through which pain could happen to the body. Examples of chronic diseases are the likes of cancers, arthritis, fibromyalgia. Chronic disease pain could bring inflammations, and it could also bring neuropathic pain to the body. Number 7 is psychological and emotional pain. Psychological and emotional pain. This could come on account of stress. Then number 8 is what I call the unknown or complex causes, all right? For example, what we call chronic pain syndrome or oversensitive nervous system. Now, this happens when your body has probably gone through chronic pain. When I'm talking about chronic pains, we're talking about pain that has sustained for 3 months and above, all right? So when the body has sustained pain and the nervous system has gotten accustomed to it, so even when the body heals, the system is already used to firing message of or signal of pain, and so it doesn't stop. The body has gotten accustomed to it, and so we'll call it complex causes of pain. I've mentioned 8 factors or 8 avenues through which pain could happen in the body. Now, let me establish this fact. There are nerves or there are nerve pathways through which pain is communicated to the body. Some are fast, some are slow. There are 2 categories. We have the C fiber nerves. We have the A delta nerves. The C fiber nerves are the unmyelinated type of nerve. When we mean unmyelinated, we're talking about fat sheets. It's a loop through which the nociceptors are able to pass message to the brain. So the C fiber nerves are slower, while the A delta nerve fibers are faster in sending message. So take for example, if you put your hand inside fire and immediately remove it, it is because the message passed through the A delta fiber and send message to the brain that something is wrong with the body, and it gives you fast response. Remove your hand from that fire. So While the C fiber, they are the unmyelinated, don't have plenty myelin sheets on the pathway, and so they send this message slowly but surely. It is common with chronic pains. All right, so that's why you see a situation whereby a person is going through a sustained pain. You wake up every day, you're experiencing that pain. It is slow and sure. It keeps reminding you one part of your body is paining you. Now, let's talk about pain treatment protocol. It's one thing to experience pain. It's another thing to know the right approach to reverse or manage your pain experience. Now, if you are ignorant of the right thing to do, you will suffer for a very long time. And that's why I'm doing this video, to give you a guideline that will help ease off your pain experience or totally reverse your pain experience, because there are a number of types of pain experience that can be totally reversed. Now, let's talk about the various options that you can actually apply to reverse pain. I want to take note of this. You can't use one approach to reverse all kinds of pain experience. So it's important for you to know the cause of the pain, the type of the pain, or the severity of the pain. That will determine the right protocol that you can apply to reverse or manage your pain experience. One of the most effective options is to have a combination of one or two or more methods or more approaches than just sticking to just one method of approach to manage your pain or reverse your pain. Number one, medication. When you are experiencing something like a mild to moderate pain, the usual recommended medication over the counter by the doctor is paracetamol, the likes of paracetamol. You also, when it comes to pain that is on account of inflammation, maybe an inflammation that is not too strong, the likes of ibuprofen is usually recommended by the doctor. Then when it comes to stronger inflammatory conditions, maybe caused by chronic disease, internal organs, and so on, there are stronger anti-inflammatory drugs that are recommended by the doctor over the counter, like the likes of prednisone, dexamethasone, methylprednisone, diclofenac, indomethacin, ketorolac, and so on. Then, when it comes to nerve pain medications, like maybe burning sensation, tingling sensation, and so on, then usually the doctors would recommend anticonvulsants or antidepressants, all right? The examples of anticonvulsants include the likes of gabapentin, pregabalin. Then when it comes to antidepressants, they usually recommend the likes of amitriptyline, duloxetine, nortriptyline. Then when it comes to burning sensations or tingling sensations, the doctors usually recommend the likes of lidocaine or capsaicin, and so on. Then there are cases where a patient is experiencing an excruciating pain on account of chronic disease, like cancers or maybe severe injuries, maybe surgery or whatever. There, the doctors usually will recommend opioids. Opioids like the likes of morphines, oxycodone, hydrocodone, codeine, and even stronger opioids like fentanyl, methadone, buprenorphine, and so on. Those are on rare occasions. Usually this type of opioids, they are given with extreme care, properly and carefully supervised by doctors. Number two option of treatment is what we call physical and movement-based therapy, all right? This kind, you are looking at the kind of pain that could be caused on account of maybe posture problem and so on. So you could correct that through stretching and strengthening exercises, posture correction, manual therapy like massage, chiropractic, Chiropractic, it's a manual manipulation of the spinal cord and the nerves and the disc attached to the spinal cord. All right. We have chiropractors who use hand manipulation to do that. And we have the likes of the thermal massage bed device that is designed to manipulate the spinal cord to cause a realignment. Those are the kind of physical movement-based therapy that you could apply when it comes to manual therapy. Massage is another method of manual therapy that is under the category of physical and movement-based therapy. Number 3, lifestyle changes. If your lifestyle is what causes pain in the body, then you need to change your lifestyle so that the pain will disappear. So if it's a case of living a sedentary life where you sit in a particular spot until posture is compromised and giving you pain somewhere in the body, then you need to be given into regular physical activity. If it is on account of stress, lack of good sleep, then you need to give in to good sleep. As a matter of fact, if you want to stay healthy, then you should ensure that you have at least 6 to 8 hours of sleep every blessed day. Then, if it is on account of weight, okay, lifestyle, that's what I'm talking about, lifestyle. You eat too much and you're now obese and it's affecting or causing hyperplasia somewhere in the bone, then you need to lose weight in order to recover from that pain experience. Then ergonomic work setup. What's the kind of seat you are using? Right? We have several kind of chairs these days. You can't be using a relaxation chair for your work chair. It's going to bend your spinal cord and so on. So these are lifestyle changes that you need to apply to correct that. Number 4, psychological approach. Pain is processed by the brain, and so it's talking about mental health matters. If it is the brain that is interpreting to the body that your body is paining you, then you need to also send a better message to the brain through psychological approach. Take, for example, stress management. You have to manage stress. You don't have to carry the weight of the whole world on your head. It's going to bring one pain or the other, discomfort or the other in the body. Then, relaxation techniques. You apply relaxation techniques that will help the mind so that your body doesn't fall victim of psychological pain. Number 5, medical procedures. Medical procedures is another commonly used approach when other methods or simpler methods are not working. When we talk about psychological method, physical therapy, and all that, if they are not working, then probably it's a severe case that we need medical procedures. Like, for example, someone experiencing pains from cancers. Some of these people, they inject them with steroid injections, nerve blocks, or even surgery for maybe severe disc issues. Those are medical procedures that are used as a method to reverse or to relieve or to manage pain in the body. Number 6, complementary therapies. We have the likes of acupuncture. Now, when it comes to acupuncture, what usually happens is this. The nociceptors, those messengers, those special messengers, their job is to send pain signal to the brain. When they send pain signal to the brain, then the brain interprets that your body is paining you, and then they will cause a discomfort that will make you react to do something about it. But when it comes to acupuncture therapy, what usually happens is that this type triggers or activates its own kind of chemical messengers, and nociceptors are examples of pain messengers. But we have what we call non-pain messengers, like the endorphins, the serotonins, right? Acupuncture goes to trigger such chemical messengers, thereby trying to reduce the number of nociceptors that are sent to the brain in order to reduce the pain experience, or if possible, totally reverse it. That's acupuncture is a very, very fast, which I also recommend, a very, very fast method that can reverse pain. A chronic pain that has been there for 3 months could disappear in 10 minutes if you use acupuncture approach. Then we have heat and cold therapy. For example, if you had a ligament sprain or a muscle strain and so on, heat or cold therapy are approaches that you use. You apply ice block or you apply heat, as the case may be, to numb the pain there until the tissue damage or the muscle damage or the nerve damage recovers. Then another complementary option is massage. Manipulate the muscles to trigger the secretion of endorphins, serotonins, in order to reduce or reverse pain in the body. Now, this approach is for cases that are not very severe. Now, I want to learn with the last treatment option, and that is my catch, device-based therapy. Device-based therapy. We have two options. We have the TENS therapy and we have the PEMF therapy. I want to stay on PEMF therapy. That's where my story started from. But let me quickly talk about TENS therapy. TENS, the TENS, is talking about transcutaneous electrical nerve stimulation. Here, TENS activates non-painful nerve fibers to compete with nociceptors. That's nociceptors, we're talking about the painful nerve fibers. The painful nerve fibers sending signal to the brain that pain is going on in the body. But we also have non-painful nerve fibers, and TENS tends to activate that. When you apply it to where there's a pain in the nerve or muscle of the body or tissue of the body, then spinal cord acts like a gate and it tries to block the number of nociceptors that are going to the brain. It reduces it or blocks it so that it's not sending too much nociceptors. And with that, you just discover that the pain is numbed, even though it doesn't deal with the root cause of the problem, but somehow it reduces the pain experience. Well, where I'm going to is PEMF therapy, pulse electromagnetic field therapy. Pulse electromagnetic field therapy is a non-invasive treatment that uses low-frequency electromagnetic pulses to stimulate tissue repair and alleviate pain. When I'm talking about pulse, okay, so it's like this is a coil, let's say copper wire coil, and the whole space are filled with electromagnetic field. Now, what happens when it comes to pulse electromagnetic field is that it's attracting electromagnetic field to pulse around the coil region. And what it does at intervals is to send low frequency electric charge to the body, to the cells, tissues, and organs of the body. So, PEMF therapy works by generating electromagnetic fields that induce electrical charge and activate or promote ion movement within the cells. Can you see how this works? That's the difference between TENS and PEMF therapy. TENS will just block the gate through which pain, that's nociceptors, are sending pain signals to the body, and rather send non-painful signals to pass through to the brain, so that the brain will go and numb the pain. But when it comes to PEMF, pulse electromagnetic field, what it does, it doesn't directly reverse the pain immediately. It does something better. What it rather does is to modulate, that's to regulate the biological process that reduces pain over time until it addresses the root cause of the problem. So that's why I said earlier on that what it does is to induce electrical charge that will cause ion movement. Ion movement like calcium. If the body needs calcium to repair somewhere in the body, it's moving it. If the body needs sodium, it's moving it. Another thing that PEMF therapy does is that it improves cell membrane activity. Take for example, you have a broken bone, a damaged bone, and your bone needs remodeling. PEMF therapy, with the kind of charge it is stimulating, charging up the ATP, what happens is that it promotes the production of the osteoblast cells that are responsible for build-up of bones and so on. And it supports normal cell signaling, lowering the production of cytokines. Cytokines are chemicals that signals pain to the brain and cause one part of the body to be experiencing pain. So basically, PEMF therapy supports damaged tissue repair, reduces swollen tissues, improve microcirculations, and this is how it is able to reduce or reverse pain in the body. Little wonder why within 3 sessions of my 15 minutes experience with the PEMF mat, and I got recovered. Now, I have given you up to 7 approaches that you can use to treat pain. Most of these ones that are recommended by the doctor over the counter to manage pain, most of them have side effects. Take, for example, the strong anti-inflammatory drugs. They have side effects of triggering the likes of stomach ulcer, gastritis, visceral pain. That is why I am recommending device-based therapies. They are non-invasive. I personally recommend the pulse electromagnetic field therapy. The PEMF mat is a non-invasive therapy that has been proven to do a lot of pain reversal, pain management without side effects. Even for diabetic patients that experience diabetic neuropathy, what happens is that PEMF therapy has been proven to repair those damaged nerves in order for the body to begin to feel sensation normally again over time. And there are several other things apart from pain that the PEMF therapy could do. We have PEMF devices everywhere, but with different capacities. So it is not all capacities of PEMF devices that can treat all kinds of pain conditions. That is why I personally will recommend to you our own customized PEMF mat. One thing that distinguishes our PEMF mat from every other PEMF devices is all about the frequency and the intensity, especially the intensity. The amount of gauze that are in some PEMF devices are not strong enough to deal with certain chronic conditions. But the one from our own customized PEMF mat, which also has other features, apart from very high intensity, very high frequency, it also has negative ion therapy in it, it has massage therapy in it, it has heat therapy in it, it has gemstone therapy in it, it has far infrared therapy in it, and many more other features that by the time you combine it together, you just discover that it is dealing with a lot of chronic conditions. So I would recommend to you, if you are interested in ordering for PEMF mat, pulse electromagnetic field mat that will help with your pain problem, then you can contact me with the number you see on the screen and you will thank me for that.